All right, so I'm going to start, I'm going to call in my first volunteer, so please. Okay, let's have a seat. So if anybody has any questions, so they can actually ask me while I'm injecting. I have no problems doing that. So let's start. The most important thing is to try to assess the patient. And what we're going to do is that we're going to focus mainly on the T troughs for this case. So if you look at straight here, how old are you?
37.
Okay, so this 27-year-old...
37.
I'm helping you here. You just go with the flow. All right, so this 27-year-old lady, okay, as you can see over here, what she has, she's got a little bit of T trough depression that are going on, in addition to a little bit of cheek, the cheek depression that's happening in the mid-fat area. So the fat atrophy, mid-facial fat atrophy that's happening. So when it comes to treating the area, the first area, if you're going to be choosing just one area, is not to inject the T troughs first. The most important area is to inject the mid-cheek. After injecting the mid-cheek, you can actually start treating the tear troughs if you can see any deformities that happen. Okay? Now, a number of products you can actually inject into this area. Since we are in this workshop, what we're going to be injecting TCL Ultimate. So as you can see here, Ultimate is the only one that actually comes in with the 3 ml syringe. So it's quite a big one. Okay? Whenever you show these syringes, try not to show them to your patients because they get scared because they see like something that's big. So try not to show that. You did not see it, huh?
Okay.
Okay. Yeah. Boom, boom, boom. So I hypnotize her. She cannot see it anymore. It's not removed. All right, so cleaning the patient is very, very important. And some people actually like to use chlorhexidine. Some people like to use alcohol. I've seen some actually use betadine. I kind of like alcohol. The reason why I like alcohol is that because alcohol is very, very quick and it's also an antiseptic effect. Even though chlorhexidine is okay, but chlorhexidine, remember, is ophthalmotoxic. It's toxic to the eye, and it's also ototoxic. It's also toxic to the ears. So I try to avoid injecting, that material. Not injecting, to clean that area with chlorhexidine. I want you to relax. Are you guys able to see her? I can't hear them, so. All right. This is as much of it as we can. No, it's not going to go up anymore. All right, guys. All right. So I'm going to start injecting. So this is the area that we're going to be injecting. So let's keep that in mind. Okay. Now there are no major structures that are found over here, except with the infraorbital foramen, which is going to lie in the mid-pupillary line over here. So it's right in that center, and that you have a number of vessels that come out. Okay. So you want to try to avoid injecting into this area. What I tend to do, because the needle is a little bit long, so I usually will introduce it more on the lateral side. Now there are 2 different techniques you can actually use. If you're going to be using a cannula, it becomes much easier because your cannula is blunt. It won't cause any problems. However, if you're going to be using a needle, you can actually also inject in a bolus technique. And the bolus technique is very simple. You touch her, her zygomatic zygoma. You can feel the zygomatic arch over here, and you can feel a little notch that's found on the lateral side where the 2 ends meet. And what I'm going to do is that I'm going to come in, and I'm going to inject, and I've just touched bone. Okay, so you have to inject very, very deep. And then you introduce your bolus very slowly into that area. And inject a small amount. I'm injecting very slowly. It has been shown that the speed of injection is important. The faster you are, the more problems that you're going to be getting. Okay, so you inject very, very slowly. I've injected about 0.6 right now just into that area. Now remember, I told you I like to fan. So what I'm going to do is that from the exact same injection point, I'm going to switch my needle, and then I'm going to start going in. As I'm injecting, as I'm going in, I'm also going to be injecting. This is known as the anterograde. So I'm injecting a little bit more right into that area. And then I'm going to slowly start coming out in a retrograde fashion. So I've injected about 1 cc now of the Ultimate. And you can see an immediate effect that's happening right now. Sit down. Look straight into the camera. Do you guys, can you guys see the difference? There's a huge difference that's from here all the way to here. The only thing that's remaining is just that little small amount that's found right here on the medial side, and I'm going to inject it right now. Relax. I know a lot of people like to draw. They like to draw, they like to tell you that, oh, you have to inject here, don't inject over there. It's very important to know that wherever you see your defect, I like to make things as simple as possible. Wherever you see your defect, that's the area that you want to inject. Now, I'm going to be injecting right here in the center. There are no major structures that are found here. Go in and inject a little bit of a bolus. I'm going to ask her to sit. And now you can see there's a huge difference between this cheek and that cheek. And I'm going to tell her to look down. And then you can definitely see the difference between here and there. Now what I'm going to do is that I'm going to put a little bit of Redensity II right into the tear troughs. Now remember, the tear troughs is simply from this area, the mid-pupillary area, all the way to the medial side. This part is known as the palpebromalar groove. So we're mainly going to be injecting this area over here. Okay, relax. Are there any questions?
No.
No questions?
No, it's okay.
Okay. Any questions? Can they hear me? Everything's fine? Okay. Alright, so as we're going to be injecting right now, what we're going to do is that we're mainly going to be injecting into the tear troughs. I'm going to use a needle here, okay? And remember, we pointed out to 3 distinct areas. 2 of them are going to exist into the medial to the mid-pupillary line, and 1 of them is going to be a little on the lateral side. So what we're going to do is the following. So you feel you feel the tear trough, you put your finger, your left non-dominant finger, the index finger, on the orbital rim. This protects it, and at the same time does not allow the material to go into the orbital rim itself. You stretch the skin, you stretch it really well, you can see the capillaries, you try to avoid those capillaries. You're going to go in. Here I've touched a little bit of the bone, and that's what I'm going to be injecting. This area here you're going to be injecting is the souf, okay? So that's the area that you're going to be injecting. And you put your mini bolus in there, and then you come out. So you can see hardly any bleeding that happens because that area is really kind of devoid of blood vessels. Okay, so very, very safely in that sense. Then you go a little bit medial to that. Also very deep, and you inject a small amount. I'm injecting it a little bit, 0.1 right now. Then you come out. And then you massage. Massaging is very, very important. The nice thing about this filler is that it does not swell. So it has a very low hygroscopy, meaning that it won't absorb a lot of water. So it won't cause any major swelling. And then the final injection, also to the tear trough, stretch. And then you're going to go in, touch a little bit of the bone, and then you're going to be injecting your bolus over there. Now, if she has a little bit in the palpebromalar groove, you also need to inject it, and I advise you to do that while at the same time while you're doing this. And that's what I'm going to do. So the palpebromalar groove exists on the lateral side, and you can definitely inject a little bit more. Now, I've injected 0.5, so that's basically as maximum as you want to be into the tear troughs. But you can inject a little bit more into the lateral aspect. Now I'm going to ask her to sit up, and I want you to see how she looks like. So do you guys see the results on the outside? All right, fantastic. So what I injected here was about 1.5 ml of Ultimate and I've injected about 0.4 into the tear troughs and about maybe 0.1 or 0.2 into the palpebral groove. And this is basically how she's going to look like. And that's basically it. She's going to get a little bit of swelling because of the injection areas, but this will all go away with time.